So another important question that comes out almost every year, okay, is state the laws of ossification, okay, or state the laws of bone ossification, if you want to put it in full. All right, so the laws are kind of like, I think they are like four. All right, so five. There are five though. All right, so the laws are actually kind of like trickish. So if they ask you to state the laws of ossification, what is ossification first of all? Ossification is just that process where what bones actually mature, as simple as that. All right, so if they ask you to state these laws, they they will say that what all bones do this except, do you understand? So they're actually watching out to see all those exceptions to these laws that you must state, okay, to get your full marks. So moving to the laws of ossification right now, we say that the first law has it like this. The primary center of ossification, that's like the first center of ossification, primary ossification center. All right, it is single and it appears before birth in all bones except, okay, so the exception is what? Carpal bones, their ossification centers will not appear before birth but will appear after birth. Do you understand? Now, another exception to this single thing that will say that the primary center is single. So the clavicle has two primary centers of ossification. Apart from these bones, every other bones follow the law. Okay, so they are trying to what? See how you know the exceptions. All right, now the next one, secondary center of ossification can be single or multiple and appears after birth. Okay, now exception is what? The lower end of femur, the secondary center for the lower distal ends appear before birth. Okay, so say that all secondary centers appear after birth. Okay, but for the femur, it appears what? In the 9th month of fetal life, that's just before they give birth to you. Okay, so the lower end of femur, one advantage of it is when they give birth to a child, they can do some radiographic tests to see if what? The secondary center is there. Okay, so if you know that the secondary center is there, then you know that the child is viable. Okay, the child died at 9 months and all that. Okay, so it appears at 9 months and it fuses with the shaft when you are like between 16 years and 18 years. That one is just extra stuff. Okay, the one that you are trying, the main thing is just for you to state that what? Exception of the lower end of femur, which appears at 9 months when you are still in your mother's womb. Okay, unlike the other centers that will appear after birth. Okay, so secondary ossification center, primary ossification center, we've spoken about them. Then we see that the center that appears first fuses last. Do you know what that means? Okay, any center that appears first will fuse last. Okay, the ones that appear after the first centers will fuse first. Okay, there's a big exception to this rule. Okay, the exception is what? The lower end of fibula. Now, a secondary center for the upper end appears in the 3rd and 4th year of life and fuses with the shaft between 17th and 19th years. Okay, a secondary center for the lower end appears in the 1st year and fuses with the shaft between 15th and 17th years. Okay, so that means what? The center for the lower end, the center for the lower ends appears first. Okay, but it will still fuse before the center for the upper end. Do you understand? Instead of it fusing last, it will still fuse before the center for the upper end. Okay, just reason out things. Okay, now the 4th rule, the secondary center fuses together to form a single epiphysis, which in turn fuses with a diaphysis. Okay, all right, so that means what? This epiphysis later on will fuse with the body of the bone, which is known as the diaphysis. Okay, there's a big exception again. The upper end of the femur is an exception to this. Okay, so three secondary centers appear at the upper end of the femur, on one on each of the head. That's in the first year. Okay, okay, one for the head. Sorry, that's the first year. The second one will appear for the greater trochanter. That's in the fourth year. Another one will appear for the lesser trochanter. That's what, in the 12th year. Okay, so each center fuses independently with the shaft in the reverse order of appearance. The lesser trochanter will fuse at 13 years, greater trochanter will fuse at 14 years, the head will fuse at 16 years. Okay, but if this stuff is kind of like too crazy for you, you could just grab it up to this level. Okay, this down here is for anybody that is looking for distinction. All right, so the fifth law now of ossification, so that the direction of the nutrient artery is opposite to the direction of the growing end of the bone. Okay, so direction of the nutrient artery is opposite to what? Nutrient artery. See the nutrient artery? Okay, the direction is what? Opposite to the direction of the growing end of the bone. Okay, so these are the 5 laws of what? Bone ossifications. That's it.